Indiana families continue to fight for more transparency from the state and nursing homes when it comes to COVID-19 cases and deaths. Deaths at long-term care facilities make up 41% of the state's total, but people in nursing homes compose only 12% of positive cases altogether. The state is telling the public only the overall number of people who have tested positive and who have died in nursing homes. What the state is still not saying is where these nursing home outbreaks and deaths are happening. Call 6 Investigates' Kara Kenny is talking to experts and uncovered the public may soon get to see this information in a different way.
We asked the state to give us nursing home deaths and cases broken down by facility. The state declined, citing privacy reasons. But we talked with an expert who says legally the state can give us the information.
It's really sad.
David Johnson lives in Indianapolis and is one of many taxpayers concerned about the state not telling the public where nursing home deaths are happening. He's had 2 family members at Glenburn Home in Linton, Indiana. His sister-in-law died in April from pneumonia. David says he's encouraged by the fact that Glenburn Home has posted daily updates on COVID-19 cases and deaths on their website and Facebook page, something they do not have to do by law. The state's new requirements say nursing homes only have to send daily email updates to resident families about COVID-19 cases. Death information is only released to families upon request.
Totally transparent. Everybody in the community knows about it. I think that's just kind of the standard that, frankly, the state should be doing. But
Glenburn Home told us they have an obligation to keep the public informed because their friends and neighbors are also impacted by the virus. A failure to communicate during these times leaves families uninformed, which creates an additional burden in addition to that they are already experiencing. It also creates anxiety and speculation in the community, resulting in stories and rumors at a time when our residents, families, and employees deserve better. Seema Mohapatra agrees. She's a healthcare expert and professor at IU McKinney School of Law.
The people that are working there are coming in and out of those facilities. And so there is also a potential risk for the general public about what the kinds of infection rates are in long-term care facilities. That's all in the public interest and public trust. Right now, it's really important that we have trust in our institutions, and so they have to show us some kind of trustworthiness by reporting these kinds of cases.
The state has cited privacy concerns for not telling the public where people are dying in nursing homes.
And legally, there's nothing preventing the facilities or the health department from giving this information.
Nursing homes are funded with your tax dollars through Medicaid and Medicare. A new federal rule makes it mandatory for nursing homes to report COVID-19 deaths and infections to the CDC. The data is expected to be released at the end of May.
People in Indiana, even if the state department, health department doesn't release it, by the end of May, we should have so much more understanding.
When the public is not informed, they may assume the worst, and families say that needs to change statewide.
I can handle seeing all these numbers down at Glenburn. You know, it's really sad, but I'd rather see that than nothing and have families left in the dark.
In the meantime, we're compiling our own database of nursing home deaths and cases, and we want to hear from you. You can email me at kara.kenny@wrtv.com. And if your nursing home is not giving you the information, you can report it here to the state of Indiana. Reporting in Indianapolis, Kara Kenny, RTV6.
Kara, thank you. Call 6 Investigates has also filed a complaint with the state's public access counselor, and we are still waiting on his opinion. Now, the nursing home industry says once the numbers are released, you need to take them with a grain of salt. We spoke with the Indiana Healthcare Association and Indiana Center for Assisted Living.
If we were able to test everybody at the same time, or relatively at the same time, and do so consistently over time, that data would be more reliable and more important, more valuable, both to the public and to public health officials. But that's not where we're at right now.
IHCA and InCal represent more than 450 skilled nursing and assisted living properties. President Zach Cottrell says the public needs to keep in mind that the elderly are more susceptible to the virus, especially if they live with a group of other people. He says just because a nursing home or assisted living facility has a high number of cases or deaths does not mean they've done anything wrong.
With respect to the perception that nursing facilities have done something wrong because the virus attacks elderly and vulnerable populations more than others, I think is a wrong perception to have.
The trade association is working on gathering its own data, including recoveries. They say the information will help them establish best practices to attack COVID-19.